Whether you're going to see your doctor for the flu or have routine tests, it's important for you to understand information about your health. But too often, health information can be complicated and confusing. Since it's October and it's Health Literacy Month, we take a closer look at this issue and what you should know before your next doctor's visit. And joining us, we're glad to have back with us Dr. Carolyn McClain, Medical Director with the Urgency Room. Thank you for being with us.
Yeah, thanks for having me.
So how big of a problem is this, and who's most affected by if they don't understand what's being told about their health, or about their test, or about just general information?
So I think everyone is affected by this, and I have a couple examples from things that just happened last night at the urgency room. So I had one gentleman who was just discharged from the hospital, and he had pneumonia. But during his stay, he had been diagnosed with high blood pressure. So he'd gone home on a new high blood pressure medicine, and he'd taken the medicine twice, and he'd checked his blood pressure every 2 hours for 40 hours, and his blood pressure had just gone down a little bit. And so he came in to see me because it wasn't working, and he knows high blood pressure is very serious, and how do I fix this? And what we didn't communicate with him is that his blood pressure was not going to get fixed quickly.
Oh.
It takes a while, and you can't, he's on a very low dose of blood pressure medicine, and it takes a while to ramp that up to make sure you get the right dose, and he should expect his blood pressure to be better in 2 to 3 months. But in his mind, his blood pressure was really important, which it is, and it wasn't fixed. So we didn't set the expectation that it's going to take a while. So another example of this is when your kid has a cold or a virus, and they have a high temperature, and their temp gets, scary temperatures. They get to 105, 103, and you give them Tylenol, and it comes down, and 3 hours later, it's back at 105. That's exactly what happens. But parents don't always know that. They think, well, the Tylenol's not working. Well, it worked for 3 hours. That's all it does. So we have to get better at explaining what you should expect so that we can help you to get through your illness. Because most of us in medicine, we know exactly, oh, this is going to last 5 days, and you're going to have a fever, and it's going to go away for 3 hours, then it's going to come back. But we don't explain that to you. We just say, you have the flu, and you're going to be sick for a little bit, and take Tylenol and ibuprofen, and you think that's going to make it better. It just makes it go away for 3 hours.
Plus, it seems like when you get this long list of here's the things that you should know, and it goes in and out without, what was that again? Or if they tell you and you're you have a sick child and you're only half listening or something like that.
Yeah, and there's a lot of information on the internet, which is good, but also kind of a fear-mongering, because people get really worried. So another example would be in a communication issue is a gentleman came in yesterday who had knee pain, and he had knee pain for 2 years. So in my head, I think, okay, you've had knee pain for 2 years, so why tonight? Why are you here tonight? And he has a whole reason why he's here tonight. It really hurts, and we do an x-ray, and I go in and I tell him that the x-ray just shows that this is arthritis. It's probably going to hurt. These are some things you can take. And he says, oh, thank God, because my best friend just got diagnosed with bone cancer in his knee, and his leg needed to be amputated. Which is why he was there that night.
Oh, how frightening.
But the communication issue, like I could have told him he didn't have bone cancer, but it's hard for you to even communicate that to me, because that would be putting in words something that you're really afraid to tell me.
So what should our viewers, when they go to the doctor, whether it's the urgency room or to the doctor's office, what should they do to help improve this communication, get rid of some of this confusion and things like that? So
I think 2 things. One is be honest about why you're there, because a lot of people don't want to tell you that, you know what, my mom died of brain cancer, and that's why I'm afraid of this headache. They don't want to have that conversation, and it's a hard conversation, but it helps me understand what you're afraid of, and it helps me one, that's good information for me to know that that runs in your family. And two, it helps me help you. Then the other thing you want to make sure you are clear about before you leave is, when am I going to get better? How long am I going to feel like this? Is it normal to still be sick in 2 days? And when do I have to come back? When is it not normal for me? For example, if you're throwing up, I can give you medicine and it's going to make your vomiting better, but it may not make it go all the way away. But after 2 days, you shouldn't still be throwing up. Then I want to see you back. But that should be clear in your head, when you need to come back and what you should watch out for.
And it seems like typically, too, when you make an appointment, they'll say, make sure you bring in all your medications. Why is that? And I think people think, well, this maybe is not, they don't need to be concerned about that. But, I mean, why should you bring them in?
So what's really helpful, it doesn't necessarily have to be the bag of medicines, which is absolutely helpful. But if you have a list of your medicines and their doses. So one of the things people they'll say, I'm on this medicine, and they don't know their dose. So let's say you have very high blood pressure when I see you. If I don't know what dose you're on, I can't increase your dose. I can't help you with that problem. So it's really helpful to know. The other thing that those medications tell me is, if you're on a low dose of a medicine and you have high blood pressure and you're on a very low dose, I know your normal blood pressure is not a lot higher. Whereas if you're on 5 blood pressure medicines and you're on the highest dose, I'm not surprised that your blood pressure is a little high, because it's very difficult to control your blood pressure. So what medicines you're on tells me a lot about what your medical history is. Not just that you have high blood pressure, but how severe is your blood pressure.
Well, great information. So if people want more information about health literacy, or about dosage and things like that, and then also about the urgency room, they should just go online? And
yeah, we have a website, and please, if you have any questions about any visit, you should always call your doctor back. They always have a nurse or a doctor available to answer your questions, and we do at the urgency room as well.
And you're not going to be bothering them. That's what they're there for.
You have to call. Yeah, absolutely.
Well, Dr. McClain, always great to have you with us. Always good information. Thank you.
Thanks.